Madam Speaker, and I want to thank the member from Prince George Valemount for moving forward the motion. It is important to be able to have debate on this bill in the legislature, and I think it's nice that we're actually getting to talk about this. But we should also know the history of this bill, and as the Health Minister said when he introduced the bill, this was a collaborative effort by all three parties that brought forward this bill into the legislature. And all three parties, to the best of my knowledge, voted in favour of it at first reading and second reading. The issue that I've got with Bill 36, and I'm glad to see that the official opposition is now raising concerns about this, the issue I have certainly does come from the healthcare workers themselves. And to that point, the Canadian Society for Science and Ethics in Medicine, CSSEM, which is a group of doctors and nurses, have done a lot of work on this bill, including creating a petition that I've been helping to circulate around. And I'm happy to pass this petition on to any of the members of the official opposition if they care to sign it, which is in opposition to Bill 36. So far, across this province, more than 16,000 people have signed this petition, and more coming in every day. The CSSEM put a lot of information on their website associated with Bill 36, and I want to read some of that now. And I quote, "Our primary goal as healthcare professionals is to provide the highest standard of care, a standard which emphasizes ethics and quality while free from unprofessional discrimination, racism, and sexual misconduct. The unequivocal support of a system which upholds these values. We also support a system that embodies unity and democracy while creating public policy. These qualities help reassure British Columbians that they are receiving quality of health care they deserve. However, without a democratic and collaborative policy-driven process, our system risks erosion to the quality and safety of care we can provide. Bill 36 will single-handedly deteriorate the quality of health care in British Columbia. It will cause deleterious, catastrophic, and irreparable consequences to our system and patients. Bill 36 promotes partisanship and the authority of our government to unilaterally dictate how healthcare services are delivered in British Columbia. Political influence has no role in healthcare, and that is exactly what Bill 36 entails. Failure to repeal this act will have devastating consequences on healthcare in British Columbia." That's directly from doctors and nurses in this province that have a concern with this bill. And I have been out speaking in town hall meetings, speaking with doctors and nurses. I've been out at healthcare rallies talking about this bill. And what I've discovered is the complete lack of information that healthcare providers actually have. There has been no broad effort to engage with healthcare workers in this province. Bill 36, quite frankly, is a bit of a surprise to them, especially when you start hearing some of the things that are in this bill. I want to read some more comments with regards to this bill, in particular from a doctor. And the key here, Madam Speaker, is about science. And science and medicine are always a work in progress. Without scientific debate, science cannot progress. The facts are always evolving. Anyone who has the most basic understanding of science will know that the concept of scientific misinformation is an oxymoron. Madam Speaker, the debate of science needs to develop, and it needs to develop through open dialogue, through allowing doctors and nurses and health professionals to be able to have this. Informed consent and the concept of patient bodily autonomy is the bedrock of medical ethics, and yet the ethical healthcare professionals who hold these principles have been fired from their jobs and refused to take the vaccine, thus creating a healthcare crisis in the public healthcare. And I've raised this issue with the minister on many times. History, Madam Speaker, is full of examples of how scientists have spoken up. Professionals have spoken up against the orthodox of the day and were punished, were imprisoned, were under house arrest, and yet they were proven to be correct. They helped to push the science, they helped to push the knowledge of science. And I think if we want to have a good healthcare system in this province, if we want to have a healthcare system that people can have confidence in, it's important that people aren't muzzled and they aren't forced to follow the political doctrine of a government. So that's why I'm happy this is coming forward, because quite frankly, more debate on Bill 36 is needed.
Thank you, member.